All right, I got Dr. Grant Elliott on the show today. He is the founder of Rehab Fix. He's a doctor in chiropractic and sports medicine in the Tampa Bay area, specializing in treating disc herniation and sciatica through non-surgical methods. Dr. Grant, welcome to the show, brother.
Thank you. Stoked to be here.
Dude, excited to talk with you because sciatica is a big, big problem. I talk to a lot of people in the world, and when they start telling me they have lower back pain, I'm like, let me guess, L4, L5. And they're like, yep, how'd you know it? That's the surgery, right? That's the one they had all the time. But sciatica is tricky because there's just so many different root cause things that could be causing it, as you know. But before we kind of jump into how you start specializing in this, I'm always curious, like, there's so many different roads you could have gone down in your given your background. Like, how did you really start specializing in disc herniation and sciatica specifically?
Yeah. Well, originally, funny story. The reason I wanted to become a chiropractor is because the chiropractor failed me. And most people go, "What?" Usually, you go into a certain specialty or medicine because you had a great experience. I'm the opposite. So I was racing competitive cross country mountain bike racing. I started getting back pain. Started significantly impacting my races. This is about 10 years ago. I started bailing out of my races. And I was like, dang it. So I went to see a traditional old school chiropractor. See me 3 times a week. Oh, your spine's crooked. Look at this x-ray. Just, 2-minute crack pop, get out of here. Whoa, it didn't help. And my races just got worse. I developed pain. And so I stopped racing. So then I just got into the gym because I needed to do something athletic. Saw a guy doing some cooler, like mobility type, like movements. And I was like, those are like unique movements. Started chatting with him. Ended up being a chiropractor, had a conversation. I was like, this sounds very different than what I experienced. When shouted him, he was doing a bunch of rehab with people, teaching movement. And I was like, all right, this is sweet. I want to learn this. I always wanted to go into some form of health. I just didn't know what. So I was like, this is awesome. If I'd got this, my story would have been different. So that's what made me want to go into the realm of physical rehabilitation, rehab, all that. What got me into low back specifically, though, was really not my choice. It was really what my audience, or if you want to say the world or God, put me, because I was about halfway through school and I recognized I need to start posting on social media. So I started making rehab videos because I was really into rehab and movement and exercising and helping people fix their issues, teaching people how to fix themselves. And I eventually grew 100,000 followers within a year of me starting to post. And as I continued to post more and more and more, I just noticed that my low back videos would get the most traction. I get the most questions, but it also was an area that I was really focused on because I myself dealt with these low back issues in the past. So it was an area that I did a ton of extra courses for, things that school does not teach you. Everything we do in our online program, it's not what school taught us at all.
Why the heck? Why are people going to school then to learn stuff that's irrelevant? This blows my mind.
Yeah, it's funny. Everything we're doing is not. Yeah, you get crumbs of really what you need in school, but that's what anyone should say who is highly proficient in any area. Any area, doesn't matter.
That's true. Yeah, that's true.
So I took a lot of extra courses and stuff for low back stuff, and I was really good at it. Really good at it. So the types of videos I would make, the types of exercises and methods I would show would get a lot of traction. So I used to post about everything, but my low back stuff became the most popular. And then eventually when I learned more of a marketing business side of things, I realized, hey, I'm posting about everything. And so I feel like I'm helping less people. I need to dial in on one thing to help those people the most. And so I was like, all right, I need to find a niche. What should I niche down to? And my audience told me. So I niched down to low back and started making 100% of my videos about low back pain and low back related things. So disc herniations, sciatica, and just made that our number one mission. And then we grew super fast and we're the number one online low back program in the world. So that's what we do.
Yeah, that's incredible, man. Congrats. Okay, talk to me about, these traditional methods, because even like you said, I have people on my network, ARTs, rolfers, chiropractors. I love them all, man. I love them all. But I have definitely bounced around to every single one of them, and they all do certain things that are different but better and just different. And sometimes none of them get me better. So talk about some of like these traditional PT, folks, or even a lot of times, you hear this, I'm sure you get a herniated disc and then like surgery becomes the first option that they're pushing. these models tend to make people worse. So why do you think that is? Why has the system gotten it so wrong? And where do you see like what you're doing kind of really just changing that?
First, 97% of disc herniations can be resolved without surgery. This was a massive study, documented about 280,000 people. This was in 2020. 97% can recover without surgery. But let me ask you this, Joel. Do you think only 3% of people with a disc herniation are getting pushed to surgery? No way.
No, of
No way.
course not.
So many more. So many more.
Yeah.
So the biggest reason is that a majority of our healthcare system has been built on the biomedical model. So this is traditional Western medicine. So what is the biomedical model? It is that we need to see or diagnose or test what that problem is and then only treat that problem. So it's, hey, I have back pain. Okay. We have no idea what's going on unless we take a scan, and whatever shows up on that scan, that's what we're going to treat. That's the biomedical model. And what we know now is that is not at all accurate, because there are many age-related changes that we can find on the body from various scans. 50% of people, if you take an MRI of their lower back, will have a disc bulge, but no pain. So if you take all the people in the world right now who have no low back pain, but you do an MRI on all of them, 50% will have a disc bulge. So the mistake is someone coming in with low back pain going, all right, first thing we're going to do is a scan because we're not going to do any testing. We don't know what to do unless we have a picture of it. And then there being a disc bulge, and then going, that's the thing. When in reality, it could have been so many other things. And that disc bulge could have been there the last 5-10 years and could have never caused a problem and would never cause a problem. But now because they see it, they're making it the problem, and they're treating the individual in the incorrect way. So that's the biomedical model. We need a test for everything. We need a diagnosis for everything. And that's the only thing that we're going to treat. Now, getting any form of rehabilitative care is going to be better than that, is going to be better than scan, cut it out. The only thing we can address is ejections or cutting it out. Any form of rehabilitation is going to be better than that. But within the forms or the realm of the world of rehabilitation, there's obviously more evidence-based forms of that and non-evidence-based forms. So what I want the listeners or the viewers to do is imagine a bubble in your head. Imagine there's a big bubble, there's a big circle, and within that circle is like a little one that's 20%. Okay, imagine that. So the big circle is 80%, the small circle inside of it is 20%. 80% of your care for common musculoskeletal conditions should be active therapy. So active therapy is what you can do for yourself. So this is lifestyle changes. This is rehabilitative exercises that you are doing on your own. Things that you're being taught to become independent and in control of your body. That should be 80% of what you're doing. 20% can be passive therapies. And I say can be, not has to be. The circle can be 100% active therapy. It can be 20% passive though. So passive is things that someone else is doing to you or for you. So a massage would be passive therapy. Soft tissue work would be passive therapy. E-stim, laser, decompression, things that are being done to you where you can just lay on a table and do nothing. That is a passive therapy. That should only be max around 20% of the treatment spectrum that you are receiving. The problem is when there's many outdated chiropractors, physical therapists, massage therapists, orthos, whoever, any profession, it doesn't matter, when they're doing almost 100% of the passive therapies and then are surprised why the outcomes are not good. Because no one can fix your body for you unless you're doing active things for yourself to take control, to gain independence of your body. You need to be taught what you can do.
That's so critical, man. I was just thinking as you were talking, right? You go to a chiropractor, snap, crack, pop, 2 minutes, you're in and out. You feel good for a little bit, but then again, your fascia, right? Your bones might adjust, temporarily, but then your fascia and all your incongruencies, all the things that are already wrong with your body, the balances, the weakness, the asymmetry, you start to pull those bones out of place again. So if you're not actively doing something, then you probably aren't going to be able to reset your nervous system permanently so that you're not being out of alignment consistently, right? Fair to say?
100%.
Yeah.
You can't just lay on a table, all right, fix it for me, but nothing in your life changes. Nothing changes in your function, your strength, your mobility, your education, your beliefs All of these things affect the experience of pain. So it's very negligent to think, oh, this person who's in pain, it could be from all these different facets. Their misunderstanding of pain, maybe they have high social stress, anxiety that could be contributing to their pain. Their movement patterns are off. They haven't been in the gym in 10 years. These are all different things that would be way higher in their priority list than getting adjusted, but it's neglected.
Yeah, huge. Have you, so obviously someone comes to you with a herniated disc, you're like, no problem. Like,
No
right? It's
problem.
like, this is easy.
Easy.
97%, watch me reverse this 97% of the time. So I mean, how many times have you seen people come in with herniated disc? And on average, right? Everyone has their own bio individuality, but how often, Dr. Grant, are you able to see some positive results where they go back, they get an MRI and it's like, oh my God, you don't have that anymore.
Well, you bring up a whole other conversation. So, first off, we need to delineate. We need to delineate the term between success, results, and something no longer being present on an image. Those are two different things. So, the absence of a disc herniation does not mean success. And because we have this presence of asymptomatic findings, people who don't have any pain where something can be found in an image, because it's also true that the presence of something does not mean a problem. So absence of something does not mean no problem. Presence of something does not mean problem. So it is not evidence-based to determine someone's result based on the change in a picture. We do not want to determine outcomes that way. We want to focus on the result that the person is experiencing. So what I care about, so like Joel, if you came to me, hey, I have back pain, I got an MRI, I have a disc issue, and these are the symptoms I have, and I can't ride my bike anymore, I can't play with my kids. Okay. The only thing that matters to me, Joel, is that your symptoms are gone, you can function highly, and you can do whatever you want without pain. That's the only thing that matters. The mistake would be if we went through our appropriate protocols and we got you totally pain-free and back to your life. The mistake would be us telling you, now, in order to see if you're actually healed, let's go see what the MRI says. Because many times the MRI can show the same thing. And people are going to think, wait, but if the disc is still an MRI, like then I'm not healed, I'm not recovered. And this is where the biomedical model has set us up in the wrong light, because they've made the test, they've made the diagnosis the determining factor. And that's not true. That disc bulge that might have been there when you had pain, sure, let's say that is the reason for your pain. That is the reason, okay, we treat you, you're pain-free. That doesn't have to go away for you to be recovered. It can calcify. It can regress enough. Like 3 millimeters of regression can be all that's necessary to completely remove your pain. And it could stay in that state. It could become stabilized, and it could never cause a problem for the rest of your life. So I'm circling all the way back now. Have we had clients who had a pre-program MRI and a post-program MRI, and the disc herniation has been gone? Yes. Have we also had clients who did a pre-program MRI, post-program MRI, and they were the same, but their lives were completely changed and they've stayed pain-free for years and years and years? Yes. And both of those results are just as good.
That makes total sense. Yeah, that makes sense. A herniated disc really is just the disc kind of slips out of like the vertebrae in the spine. Is that right? It just kind of gets pulled out slightly. But like you said, if that's happening, if it's just pulled out, it's so interesting that the human body, that you would think in my head, you would have enormous pain. Like the brain would be sending signals like, hey, well, this is out of place. But it actually doesn't sometimes.
Yep, many times. And that goes for other regions of the body too. So if we were to take an MRI of your and I's shoulders right now, there's a very, very high probability that even if, I don't know if you have any shoulder pain, Joe, but I don't. But let's say we both don't, okay? Let's say our shoulders are fine. Very, very high probability that if you and I both got x-rays and MRIs, we would find some degree of tearing in our rotator cuffs, some degree of tearing or lacerations in our labrum. Very, very likely. Very likely. So we don't want to make all of these decisions just based on pictures. If you take a scan, you're going to find something. It doesn't mean it's a problem.
Yeah. Talk about, Grant, talk about some of this mental resilience, because what I was thinking too as you were talking is like, okay, well, what if fixing your back isn't even about your back at all? And I know one of the things you were just talking about was mental resilience, your beliefs, and how that actually might play a bigger role than many of us, even realize. So how can someone reframe that pain?
Societal has a terrible narrative around low back pain. Everyone knows someone who had a low back pain experience, and they have it in their head that, oh my gosh, if I ever get low back pain, that's it. I got it for life. It's a death sentence. I'm going to be on the surgery table, or I'm going to be in a wheelchair, and that's it. And that is not true at all. Low back pain is incredibly common and incredibly recoverable. It is not a death sentence. You can absolutely recover from it. But the reason many people stay in a chronic pain state is because of their beliefs of that societal conditioning and medical conditioning when they experience it. So if you or anyone listening, if you knew nothing about low back pain, you would not view it or experience it any differently than if you stubbed your toe on the edge of your coffee table. Oh, I got some pain this morning, or oh, I slept a little bit weird, feel a little bit of pain, whatever, you go on with your day. But if you might have heard the wrong message, maybe your Aunt Susie has been talking about her low back at every single Thanksgiving, Christmas, and Easter for the last 10 years, and you have it in your head that low back pain is the plague. And then one day you wake up with low back pain, your beliefs about that experience will absolutely overcome your mind. And that will no longer go from a normal pain experience. Hey, I slept a little bit weird. Hey, I, did a few extra squats yesterday without the most perfect form. I wasn't prepared for that movement. I did a run and I haven't ran in a really long time. Common pain experiences. It would turn from a common pain experience to now a chronic pain experience just because of your beliefs regarding it. So mindset is absolutely huge and is such a big component of low back pain and chronic pain as a whole, and is not addressed enough throughout healthcare, but mindset's everything. And there are many circumstances where someone comes to us and they're either in a heightened pain state because of complications at their job, maybe their relationships, their marriage is stressed. Maybe they just recently had a traumatic incident with a loved one, a health concern that could rapidly increase someone's pain. Or just the fact of they're not aware. They don't know why they're in pain. They're confused. They're scared. This can increase someone's pain as well. So there are multiple facets of this, and mindset is massive.
Huge, huge. What are the most common things? Well, actually, I want to start talking about sciatica, and then I want to start getting into like how you actually do it, like the mastermind of like how do you actually start fixing people and getting these great results. But I wanted to actually ask you just kind of a selfish question, because I hear this all the time about posture and perfect posture, and Kelly Starrett, right, who is very well known, but he talks about this neutral stance and this neutral posture. And then I hear other guys saying that's not even possible to achieve. You can't be in this neutral state all the time. And like when you're an athlete and doing things and moving in dynamics, that doesn't even happen. So we hear about posture and posture being perfect, right? But what does the science actually say? And should that be something that we actually obsess about?
Yep. So the evidence shows that there is no perfect posture. There is only the right posture for you at that time. So just as though we think of military posture, oh, looks perfect. Ask anyone to stand in military posture for over a couple hours. How do you think they're going to feel? Terrible.
Yeah.
They're going to feel awful. Same thing if I slouched on a really low couch and I looked like a shrimp for a couple hours. Well, I wouldn't feel good like that either. So it's not the position that you're in, it's how long you're in that position. The best posture is the one you're in for the next 5 minutes, meaning frequent movement and as many different postures as you can be in is going to be the best solution for you. But obsessing about structurally changing your body to look a certain way all the time because that's what society or some influencer has deemed as perfect does not align with the evidence. Posture does not cause pain.
Gotcha. Okay. Okay. Talk about, I know you're a sciatica guru. Matter of fact, you've helped Andrew Huberman fix his sciatica. What did you do? Well, let's talk about some of the root causes first of sciatica, and then I do want to kind of hear like what you did differently with him, and maybe some of the people that, because this is a huge epidemic, sciatica. Um, I guess why do you see this being such a big problem? Like, what are some of the root causes of sciatica? Is it a tight piriformis? What is it, man? Like, what's going on with this?
Yeah. So the number one reason for sciatica is a disc bulging and hitting a nerve. So imagine a hose. Imagine you reel out a hose in your backyard and you drop a rock on the hose. That's the same thing as a disc hitting a nerve. Now, wherever that hose goes, pain can now travel down that hose all the way to the end of it. That is how sciatica works. So sciatica on paper is a general term that just means pain traveling down the back of the leg following the track of the sciatic nerve. So multiple different things can cause pain to travel down the back of the leg. The SI joint can refer, if you have a different muscle spasms or trigger points, that can refer pain as well. But if we actually have sciatic nerve based pain, that can travel anywhere from the lower back to the glute, hamstring, calf, foot, or toes. It can cause a burning sensation, a tight pulling sensation. A lot of people will say, oh my gosh, I don't know why, but all of a sudden my hamstring or my calf just feels like a tight rubber band, like it could snap. That's nerve tension. That's your nerve going, we don't want to move. It can also cause numbness and tingling. These are very common symptoms, not scary symptoms unless they're rapidly progressive, but these are really common symptoms. So a disc hitting a nerve, that's going to cause impact on the nerve. It can cause inflammation and pain, and that can travel anywhere down the leg. There are other causes of sciatica, just not as common. One term that a lot of people might have heard is the term stenosis. Stenosis is a narrowing of the canal that the spinal column or nerve roots go through. So you can have stenosis in different areas of the spine, but to keep it simple, the IVF stands for intervertebral foramen. It's the hole in the side of your spine that the nerves go through. So typically individuals above the age of 65 would have the potential to be affected by this thing, stenosis, where you have a bony overgrowth. That column grows more bone, it gets smaller, and that starts to encroach and pinch onto the nerve. That can cause sciatica. Yes, there is that term piriformis syndrome. That is an extremely over and misdiagnosed condition. Extremely. If you look at the evidence, I believe it's under 5% of sciatica cases could be related to piriformis syndrome. It is so much less than what is perpetuated, but can be related to certain capacities. So the function of the gluteal muscles, the tonality of them, yes, addressing the piriformis, improving glute strength, and hip mobility can affect sciatica, yes. But disc bulge is number one.
Disc bulge. Wow. Okay, I did not know that. So talk about, what were you doing with Huberman? What was so different about what you were doing from some of the things I'm sure he had already tried to do? And what do you think the average person, can learn from just his recovery as an example?
Yeah, super simple. So we got Andrew Huberman completely out of pain. You can see his testimonial, completely out of pain, literally within 24 hours. And that does not happen with everyone. I'm not making that as a standard claim for our clients. There's some people who require longer and some people who can get results very fast. And so his situation was a very classic disc bulge. He was lifting in the gym, was exercising and felt a pull or potential pop. I'm going based on memory quite some time ago. And then, the next morning, this is classic. Next morning, could barely stand up straight, getting out of bed. A lot of people feel stuck in a forward position. Also, if you've ever experienced pain with coughing, sneezing, bearing down, these are disc bulge related symptoms. And so he had very classic symptoms, and we had been connected prior to that. He messaged me, he texted me, and he was like, hey, I'm dealing with something. So I was like, yep, sounds like a disc. So for most individuals, all we simply did with him was, if we think, what's the most common position or movement that our spine gets throughout the day? It's a flexed forward position. It's sitting in a forward position because you sit at work, you sit while you're eating dinner, you sit in the car, you sit to watch TV. I'm not saying sitting is bad. I'm not demonizing sitting. But what I'm saying is a lot of us tend to get forward-based motions in our life. So when the average individual experiences a disc bulge or disc herniation, vast majority of the time, it's what's called a posterior bulge. So the bulge is going towards the back of your spine, so behind you. And this is typically increased by forward-based motions. So sitting long periods, bending forward. So if we know, hey, we're getting too much of this forward posture, this forward motion throughout the day, and that could have been related to causing this disc, let's do the opposite motion to balance it out, to reverse that amount of stress. So it's like if I held my elbow straight all day long, it would get fatigued. I go, oh, okay, I'm so happy to get out of that position. Get it bent. Opposite's true. If I held my arm like this all day long, I go, oh my gosh, I'm dying to get out of this position. Oh, I'm going to straighten my elbow. Oh, that feels so much better. Let me restore the motion the opposite way. Same thing for your back. So all I did with him was I had him lay on the ground, put his hands under his shoulders like he was going to do a push-up, keep his hips on the ground, and push his chest up. So it looks like he's arching into a cobra position that would be familiarized with yoga. We got him into an extended position. It was very limited at first. Most people with disc bulges are. The key is to only go to the point of pain and back down and perform this repetitively. Do not hold it. Do it repetitively while keeping your lower back and your glutes totally relaxed. What this does is it reverses the stress that you've been placing on your spine from being in a forward position all the time by doing the opposite. And it can slowly work the disc and load it back where it came from to essentially recenter it. Although I said, hey, we don't want to look at imaging and make a determination on that. I understand this is for conceptual purposes. We're moving the disc back where it came from to take it away from the sensitive tissues and away from the nerve that it might be hitting that could be causing that sciatica. So that was the first protocol we gave him, extension-based movements, and that alone completely reduced the symptoms. I'm not saying we stopped there. That would not be wise. You want a bulletproofing process. Let's improve stability now. Let's make this actually last. But that was as simple as it was for his situation.
Yeah, that's huge. When it comes to, in your opinion, when it comes to lower back pain and just general, right? It's multifaceted, right? You hear a lot of times I've been told this, Joel, you have a weak glute med. This is your QL is getting, activated. And then I have that anterior pelvic tilt from, many years wearing a gum belt. I know, Grant. Oh no, my life is ruined, man. All these things, right? So you have this going on. You've got maybe some kyphosis upstream in the thoracic, right? And then you've got, and then I got these downstream issues with my hips and all these things. So, when you're dealing with someone like me who's just a complete wreck, a complete train wreck, right? You can't, like you said, it's not just one thing. So when people come to work with you, because you're doing everything remote, right?
100%
So everyone online. So this is awesome. So when people come, like, kind of walk me through, like, what does it look like from intake process? And then what's a typical like game plan? Do you work with people for 3 months? Is it online, like group coaching? Like, what does it all look like, brother? I'm kind of curious.
Yep. Would love to answer that question, but I cannot do that without responding to something you said a moment ago.
Okay.
You're into fitness, you're into health, all these things. Okay. If I came to you and let's say I'm 50 pounds overweight, you and I both know just simply putting someone on a caloric deficit, that being the one thing could be the only thing they need to focus on. So if I came to you, I'm 50 pounds overweight, and I said, okay, I know that, let's just say these types of eggs have these micronutrients. I need this, and I need these specific fruits and these specific vegetables. I need this exact meal plan. I need these exact supplements. And because I'm told this, and I was just saying all this to you, okay? When in reality, I'm not even tracking my calories. I'm not moving. Okay. I'm not exercising, but I'm this obsessed with all these fine, small details about, do you think it would be helpful for me, someone who's 50 pounds overweight, I just got to lose some weight and I'm going to be healthier. Do you think it would be helpful for me to add more lists of supplements to my game plan, a more strict dietary plan? These are the foods I can't eat. Or do you think it might be best in my scenario to just say, hey, eat a little bit less and move a little bit more? And let's start with that. What do you think would be better?
You nailed it. Micro habits. I think that's critical, right? Because making change, you need to kind of slow roll. People always want to go all in, and then they tank out. It's like the New Year's syndrome, right? You did great for a week, and then you got hurt, and then you never went back or whatever.
So this is the same for healthcare when it comes to low back issues. What I refer to as what you said a moment ago. Hey, I got anterior pelvic tilt. One glute med isn't activating. My QL is tight. I got these trigger points. That's called segmentation. You're taking one individual with one pain experience, one belief, one lifestyle, and then you're ripping them apart and you're segmenting them. You're giving someone who has one problem and now you're giving them 20 problems. So we go back to beliefs and confidence in oneself. Maybe this person, maybe they were a blank slate, but their back pain isn't going away. And they don't have any preconceived notions. They just don't know what's going on. Yeah. So they say, I have low back pain. I want to move better. I want to feel better. So they go to someone, they walk into an appointment with one problem and they walk out with 20. Oh my gosh, I didn't even realize my hips are uneven. No one told me. My spine's crooked. My left glute, I didn't even know that my left glute isn't working. What is this going to cause me in the future? Stress, anxiety, worry. You think that's helpful for that individual? No way. Not helpful. Not at all. When in reality, even if that provider knew nothing about low back pain, if they didn't know what the problem was, if they just said, hey, you know what? Low back pain's really recoverable. Don't worry. I'm sure you're going to be okay. Start going on some daily walks and move a little bit more and don't be afraid to. If that's the only thing they said, if they knew nothing else, that would be better advice. So we do not want to segment people from one problem to 20. Not helpful at all. Focus on the big picture. So now going to your question, and I hope that was helpful.
Yeah, no, 100%, brother.
How do we do this online? It's a movement-based approach. So we do 6 months with pretty much everybody. And the reason for that is because the evidence shows us that tissue, there's a 12-week adaptation period from physiological studies. So when we're dealing with a disc herniation, an irritated nerve, joints and tissue in the lower back that needs to adapt, we know, this is not my choice, our body has decided there's a 12-week period for tissue to adapt. So we do a 3-month pain reduction phase and a 3-month bulletproofing phase. So we get you pain-free, then we get you bulletproof, and we provide the appropriate amount of time to accomplish each one. Does that mean it takes 3 months to get pain-free? No, it does not. Vast majority of our clients will see significant improvement within 2 to 4 weeks. Vast majority of our clients see improvement during their very first call with us. We average about 30% improvement in the first call with disc or sciatica issues. 2 to 4 weeks, significant improvement, but we allocate 3 months to help the body go through this full process from regressing the disc, getting it off the nerve, remobilizing the nerve, getting it free, getting your mobility back so you feel normal again, or at least somewhat normal. We allocate 3 months to that. And then once your pain is gone or significantly reduced, now we're ready to reload your body. Now let's load your spine, load your disc, load your nerve, get you back in the gym, get you back into fitness and athletic-based things. Because no one's recovered if they're just pain-free and now they're tiptoeing through life. They're afraid to make the wrong movement. They're afraid to bend their spine. That is not recovered. Recovery is being able to bend and twist your spine, to go do heavy deadlifts and heavy squats. These are the things you should be able to do and should not be afraid of. So that's the general structure of our program, but it's tailored for everyone. What one individual needs for their disc can be very different than what someone else needs for their disc or their nerve. Then also the beliefs and lifestyles of those individuals can be very different as well and should have a tailored approach. So everything's one-on-one. We take everyone through an initial conversation to make sure that they have the type of low back pain that is appropriate for rehab. Because there are individuals that will reach out to us. We'll have an initial intake call with them. First free 15-minute call is what we provide. And during that conversation, we will sometimes realize it is not appropriate for them to be speaking to us. They need a different, maybe more emergent or maybe more specialized approach because it does not sound like a common low back issue. So just to provide a little bit of clarity, just over the course of literally 5 seconds, if people have different internal intestinal issues, those can create low back pain. There can be other forms of low back pain that are emergent situations. One classic one is someone has kidney stones. Kidney stones can refer to low back pain. Oh, I have low back pain. It's their kidneys. These are not super common scenarios, but these are just to let the audience realize that other things can cause low back pain. So if we have these types of conversations, we might say, hey, you know what? This is not a rehab focused low back issue. We think this could be this or this or this. You should seek this type of care. vast majority of the time, it is someone with a movement-based problem and therefore needs a movement-based solution. So if we check those boxes, yep, you need a rehab plan, we can help you. Then the next step is a full evaluation. So we do a 1-hour evaluation. This is where during a Zoom call, we will actually have them stand up, go through various ranges of motion, go through various orthopedic tests, neurological tests, many times when indicated, to get a full evaluation of their movement, what's triggering their symptoms, what isn't triggering their symptoms. After that, we will identify the exercises that they should do on that call to try to get a quick win, which helps serve us in our diagnostic process. So if someone responds to this exercise, we know it's likely this issue. If someone responds to this exercise, it can be a different issue. So we'll go through exercises, figure out what their body responds to. Once we figure out what it will respond to, great. Then we retest those same movements. And like I said, many individuals will see 30% improvement in the first call, sometimes more, sometimes less. Every situation is different, but that's what helps us narrow in on what that game plan needs to be for them. And then we structure that 6-month process based on that issue.
Dude, that's awesome. That is so cool. I'm looking up at the time, and I know I've got to run. I could talk to you all day, dude. I got to bring you back on for like a round 2, if that's all right. I feel like I have so many more things to ask you. Talk about, just because we're running up on the top of the hour, but talk to me if people want to work with you or they want to connect and they want to learn more about all the great things that you and your team are doing. Where can they find you? Obviously, you're on YouTube, Instagram, like where's the best place? And then if they want to actually reach out and jump into this online telehealth essentially program, like how do they do that?
Sure. If anyone finds us on Instagram, the name is at Rehab Fix on all platforms. If anyone listening or watching this goes to my Instagram and messages me just the word podcast, there's a video that is not shared anywhere. And it's long. It's in depth. And what this is this is a step-by-step evaluation where I will actually take you through our full assessment process and guide you through it, tell you if you feel pain with this or if you feel pain with that, then you're probably experiencing this. And I will make suggestions in that video based on what movements you notice pain with. And many people will see immediate improvement as I walk you through our assessment process. This is not posted anywhere. Just message us the word podcast on Instagram and it will be sent to you. And that can give you a taste or a concept of what we could potentially do. And then you'll have the opportunity to go through the next step if you found some value or relief with that, to get more one-on-one actual guidance to get a real solution. But aside from that, absolutely follow us on Instagram for more free daily videos. YouTube is our long format stuff. That's a great platform as well. But Instagram is our number one place to connect with us, and you can find us anywhere.
Amazing. Dr. Grant Elliott, the Rehab Fix. Appreciate you, brother. Thanks for being on the show.
Absolutely. Thank you for having me, Joel.